Welcome to the Paediatric Genomics update. This material has been put together in response to the 2020 Medicare funded genomic testing item in paediatrics. My name is Alan Ma, and together with Dr. Rani Sachdev at the Sydney Children's Hospital Network, we've put together a series of 4 videos. This has also been done in conjunction with New South Wales Health Genomics and the Centre for Genetics Education. We have a number of learning outcomes that we wish to cover in these talks, and by the end of these 4 videos, paediatricians will be able to firstly recognise when genomic testing would be suitable for a patient. Second, consider genomic testing, including which test to order, how to obtain consent, and how to organise genomic testing on a patient. Thirdly, explain a genomic test result. And fourthly, know when to contact genetic services for assistance. Genomic testing in paediatrics will be Medicare funded from the 1st of May 2020 and encompasses genomic testing, which means testing of all genes and DNA. This is broader than previously done genetic testing, which often includes single genes or small groups of genes. This testing can be requested by a clinical geneticist or a paediatrician in consultation with a clinical geneticist, and is for patients less than 10 years of age with dysmorphic features and 1 or more major structural congenital anomalies, or intellectual disability or global developmental delay of at least moderate severity. The rest of the talks will go through this genomic testing pathway that we have developed that helps to bring together all the steps involved in testing for your patients. This includes the Medicare indications in the first box, as well as baseline investigations with chromosome microarray, Fragile X, and urine metabolic screen, to considering genomic testing in your patient, which needs to be done in consultation with clinical genetics, as well as explaining possible genomic testing results. At any stage through this process, genetics can be contacted, especially if there are any concerns regarding pregnancy planning, consent, results interpretation. And information on your local service is available at www.genetics.edu.au. By the end of these 4 videos, there are a number of important take-home messages that we want to give across. Firstly, to recognise when genomic testing would be suitable for a patient, according to the Medicare item guidelines. This needs to be done after normal baseline testing with a chromosome microarray, Fragile X, and urine metabolic screen, and you need to ensure that this test is appropriate for your family. Secondly, how to obtain genomic consent and order genomic testing on a patient. At the moment, trio whole exome sequencing has the best yield, especially for intellectual disability and neurodevelopmental disorders. To arrange this, you will need to obtain consent for the patient, especially if it's a singleton test, or the patient with both biological parents in trio testing. You will need to send 2 to 10 mils of EDTA blood to your local laboratory for DNA extraction and storage. And you will need to check the lab requirements with your local genetic services. These services will be able to tell you what exact lab requirements there are, and also what to send with the exome request, which should be the consent forms for the patient or patient and parents if it is a trio, and also detailed phenotypic and clinical information which meets the Medicare requirements. Thirdly, you will need to know how to explain a possible genomic test result, which will fall into one of 4 categories: when a genetic cause is identified, or the possibility of variants of uncertain significance, or incidental findings, or the test result may be negative. Finally, we want you to know when you can contact genetic services, which should be at any time throughout this process, especially when you are considering performing genomic testing. And details of your local service is available at the Centre for Genetics Education website. There are also some additional resources to help you to prepare for genomic testing, and we will be including this in a handout for you to click onto the links below. I'd also like to take this time to acknowledge the team of people who have helped to put this material together. This includes a group of paediatricians, clinical geneticists, and genetic pathology, as well as the New South Wales Ministry of Health, Genomic Strategy, HETI, and the Centre for Genetics Education.